When Evie was diagnosed with CDKL5 deficiency disorder, I remember being very scared. I remember wondering if I would ever hear Evie say my name, say mom, say dad. It was a long time that I was grieving for the child that I thought I had. I pictured her in high school and going to dances and picking out pretty dresses and playing a sport and all of those things. And in one fell swoop, I felt like all of those things were taken away from her. If I could only have told myself the amount of love and joy that you find on this journey, I think I would have been able to climb out of that black hole a lot sooner than I did. I eventually realized that I needed to start thinking about the child Evie is rather than the child that I had built up in my head.
You ready to go take a tub? No? How about yes?
I think that's when I started to, I guess, accept Evie's diagnosis and realize that it was a part of her, but it's certainly not all of her. It's not what makes Evie Evie. She is sweet and sassy and sour, and she has a mind of her own, and she is so stubborn. I've learned through this journey that Evie's she's gonna create her own path, and there are no two paths down the CDD journey that are the same. I wish that I had known that in the beginning. I wanted so badly for her to fit neatly in a little package. I wanted her to meet her milestones, and I wanted her to be typical, and there's nothing typical about Evie. There's nothing typical about any of my kids. They're all unique and strong and their own little person. I think that part of the journey is learning, and it's learning and it's making mistakes and finding a strength you didn't know you had and learning how strong your kid is.
Should we go see what the big kids are doing?
What is ZTALMY? ZTALMY is a prescription medicine used to treat seizures associated with cyclin-dependent kinase-like 5, CDKL5, deficiency disorder, CDD, in people 2 years of age and older. ZTALMY is a federally controlled substance, Schedule 5, because it contains ganaxolone that can be abused and lead to dependence. Keep ZTALMY in a safe place to prevent misuse and abuse. Selling or giving away ZTALMY may harm others and is against the law. Tell your healthcare provider if you or your child have ever abused or been dependent on alcohol, prescription medicines, or street drugs. It is not known if ZTALMY is safe and effective in children under 2 years of age. Important safety information. What is the most important information I should know about ZTALMY? ZTALMY can cause serious side effects, including sleepiness. ZTALMY may cause sleepiness. Taking ZTALMY with central nervous system, CNS, depressants, including alcohol, may increase sleepiness. Do not drive, operate heavy machinery, or do other dangerous activities until you know how ZTALMY affects you or your child. Suicidal thoughts or actions. Like all other anti-epileptic drugs, ZTALMY may cause suicidal thoughts or actions in a very small number of people, about 1 in 500. Call your healthcare provider right away if you or your child have any of these symptoms, especially if they are new, worse, or worry you. Thoughts about suicide or dying. Attempt to commit suicide. New or worse depression. New or worse anxiety. Feeling agitated or restless. Panic attacks. Trouble sleeping, insomnia. New or worse irritability. Acting aggressive, being angry or violent. Acting on dangerous impulses. An extreme increase in activity and talking, mania. Other unusual changes in behavior or mood. Pay attention to changes, especially sudden changes in mood, behaviors, thoughts, or feelings. Keep all follow-up visits with your healthcare provider as scheduled. Stopping ZTALMY. Do not stop taking ZTALMY without first talking to your healthcare provider. Stopping ZTALMY suddenly can cause you or your child to have seizures more often or seizures that do not stop, status epilepticus. What should I tell my healthcare provider? Before taking ZTALMY, tell your healthcare provider about all of your or your child's medical conditions, including if you or your child drink alcohol, have or have had depression, mood problems, or suicidal thoughts or behavior, have abused or been dependent on prescription medicines, street drugs, or alcohol, have liver problems, are pregnant or plan to become pregnant. Tell your healthcare provider right away if you or your child become pregnant while taking ZTALMY. You and your healthcare provider will decide if you or your child should take ZTALMY while pregnant. Are breastfeeding or plan to breastfeed. ZTALMY may pass into breast milk. Talk to your healthcare provider about the best way to feed your or your child's baby while taking ZTALMY. Tell your healthcare provider about all the medicines you or your child take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. ZTALMY may affect the way other medicines work, and other medicines may affect how ZTALMY works. Do not stop or start taking other medicines without talking to your healthcare provider. Especially tell your healthcare provider if you or your child take alcohol, opioids, antidepressants. Know the medicines you or your child take. Keep a list of them to show your healthcare provider or pharmacist when you or your child get a new medicine. What should be avoided while taking ZTALMY? Do not drive, operate heavy machinery, or do other dangerous activities until you know how ZTALMY affects you or your child. ZTALMY may cause you or your child to feel sleepy. What are the side effects of ZTALMY? See, what is the most important information I should know about ZTALMY? The most common side effects of ZTALMY include sleepiness, fever, excessive saliva or drooling, seasonal allergy. These are not all of the possible side effects of ZTALMY. For more information, ask your healthcare provider or pharmacist. Tell your healthcare provider about any side effect that bothers you or your child, or that does not go away. Call your doctor for medical advice about side effects. You may report side effects to the FDA at www.fda.gov/medwatch or 1-800-FDA-1088. You may also contact Marinus Pharmaceuticals at 844-627-4687. For additional information, please see accompanying medication guide and instructions for use and discuss with your doctor.